Hello everyone and welcome. Welcome to Ovarian Cancer Australia's Information and Support webinar. My name is Vanessa Elford. I'm part of the support team at OCA. I'd just like to begin by acknowledging the traditional owners of the land that we're on and pay my respects to elders past and present. I'd also like to acknowledge and thank the Marion and EH Flack Trust for providing us with the funding to deliver this project. So the focus of this webinar will be on the issues and challenges faced by young women, including early menopause, and the psychosocial impact of living with ovarian cancer. We have three incredible presenters who are going to share some valuable information with you. The webinar is interactive, so over the next hour, you can ask questions to the presenters by typing into the chat box at the bottom left-hand corner of your screen. Questions will be answered at the end of each speaker's presentation. Please note that presenters cannot address individual medical cases. If you have a particular question, please call the Ovarian Cancer Australia Information and Support line on 1300 660 334. This webinar is being recorded live and will be posted on the Ovarian Cancer Australia website. If you're having trouble with the sound, you can dial the 1-800 number listed in the chat box. So I'm extremely privileged to introduce our presenters to you. Our first presenter is Professor Martha Hickey. Professor Hickey is a clinical psychologist and Professor of Obstetrics and Gynaecology at the University of Melbourne. She holds adjunct positions at Harvard University and the Peter MacCallum Cancer Centre. She's an NHMRC practitioner fellow. In her clinical practice, Professor Hickey runs the menopause and menopause after cancer services at the Royal Women's Hospital in Melbourne. Professor Hickey will talk about the effects of surgical menopause, including infertility, and the psychosocial impact this has on young women. Our second presenter is Dr. Brenda Pillay. Dr. Pillay is a clinical psychologist at Peter MacCallum Cancer Centre and the Royal Melbourne Hospital. Her research focus is on the psychosocial experiences and quality of life of patients undergoing treatment for various cancers, and is particularly interested in providing therapeutic interventions to patients and their families during their cancer experience. Dr. Pillay is going to talk about the psychosocial challenges faced by young women living with ovarian cancer, including body image, isolation, and the impact on relationships. And our third presenter is Dr. Francine Marques. Dr. Marques is a National Heart Foundation Future Leader Fellow at the Baker Heart and Diabetes Institute. In 2015, she was diagnosed with stage 3 ovarian cancer at the age of 31. She has been cancer-free for 2 years, and as a medical researcher, she's a strong supporter of research to give hope to patients. Dr. Marques will share her experience with you. So I would like to now hand over to Professor Martha Hickey.
Thank you very much, and thanks for inviting me to speak today. So I'm going to talk about surgical menopause in high-risk women and explain what that is and what the implications of that might be for health. So I'd like to start by talking about what menopause is. Menopause is the permanent cessation or stopping of menstrual periods, and it happens to all women who survive until the age of 50 or thereabouts, and it's thought to happen spontaneously because the ovaries run out of eggs. Now, surgical menopause, which is maybe more relevant for this audience, is the removal of both ovaries before natural menopause. And I'm going to talk now about the connection between ovarian cancer and surgical menopause. So one connection may be through genetic or inherited factors, because some women are at increased or high risk of ovarian cancer because they have a gene mutation such as the BRCA1 or the BRCA2 gene mutation, which increase their personal risk of ovarian cancer. And we know from extensive data that removing the fallopian tubes and the ovaries for high-risk women substantially reduces their personal risk of ovarian cancer. It doesn't completely remove the risk, but it does reduce it very substantially. And at the moment, the guidance for women who know that they're at high risk because of a gene mutation is that they undergo risk-reducing salpingo-ovarectomy before the age of 50, which is around the age of natural menopause. So for most women who are undergoing surgery to reduce their personal risk of ovarian cancer, they will have their ovaries removed before natural menopause, and so they will experience surgical menopause. In terms of a personal history of ovarian cancer and menopause, the treatment for ovarian cancer is often surgical, and it will include removal of both ovaries, even if only one ovary has been affected by the cancer. And for women who experience ovarian cancer before natural menopause, then this surgery will bring about surgical menopause. And in terms of classification of menopause before the natural time, we refer to it as premature if menopause occurs before the age of 40, or early if it occurs before the age of 45. From age 45 onwards, the timing of menopause wouldn't be considered early or premature, even if it's happened prior to natural menopause. So the symptoms of menopause will differ substantially from one woman to another. Some women may have very minimal symptoms, and some women may have problematic and troublesome symptoms for which they want to seek treatment. Some of the most common symptoms include hot flushes and night sweats, vaginal dryness, sleep disturbance, which may be due to hot flushes during the night, which also called night sweats, and mood disturbance, which may include an increase in symptoms of depression and sometimes anxiety. And those symptoms are generally temporary, but temporary may involve continuing symptoms for several years. We don't actually know how long symptoms continue after surgical menopause. For those women who feel that they want treatment for their symptoms, there are a few options to consider. Changes in lifestyle might be helpful for some women, for example, dressing in layers, so it's easy to remove some clothing to cool down, and various devices for cooling, perhaps even cold water or other such fans. There's an increasing body of evidence around non-drug treatments. For example, cognitive behavior therapy can improve the experience of hot flushes and night sweats. The most effective treatment is HRT, or hormone therapy, which includes estrogen for the treatment of symptoms, and for those women who still have a uterus, should include a progestin. But women with a personal history of breast cancer should avoid taking HRT. We don't have very much evidence about the use of HRT after a personal experience of ovarian cancer, but the evidence that we have suggests that it's safe. There are also non-hormonal treatments, some antidepressants and a medication called gabapentin that can reduce hot flushes. And at the Royal Women's Hospital, we run a dedicated service called MSAC, or the Menopausal Symptoms After Cancer Service, which is available for women in Victoria either at high risk of ovarian cancer who are considering risk-reducing surgery, or those with a personal history of ovarian or breast cancer. Thank you.
Thank you so much, Professor Hickey, for providing us with that valuable information. We really appreciate it. There's just one question that has come through, and for everyone who is on the line, if you have any questions, please type them in the chat box in the bottom left-hand corner of your screen. But one of the questions is, who should I talk to if my doctor has recommended surgery as the most appropriate form of treatment, and I don't agree with that, if I want to know what other options there are?
So the people who have the most comprehensive information about risk-reducing surgery are the family cancer clinics. So depending on who you mean by the doctor has recommended, family cancer clinics have the most information, and that includes doctors and also genetic cancers, you can also talk to your GP, and the person, the gynaecologist who might be performing the risk-reducing surgery can also provide information. The other information that's available is on the Australasian Menopause Society website about surgical menopause.
Fantastic. Thank you very much, Professor Hickey, for that. So it is now my pleasure to introduce our second speaker to you, and to hand over to our second speaker, Dr. Brenda Palais.
Thanks, Vanessa. I would like to thank the organisers and Ovarian Cancer Australia for inviting me to present today. So as Vanessa mentioned, I'm a clinical psychologist at Peter MacCallum Cancer Centre, and it's a pleasure to talk to you today about the psychosocial impact of living with ovarian cancer and how some suggestions about how to navigate this. So I'll start with a bit of an overview of the psychological impact of diagnosis and treatment for ovarian cancer on younger women. So getting a diagnosis of ovarian cancer may come as a bit of a shock, as ovarian cancer symptoms may initially be quite subtle and non-specific, and it might be attributed to other problems at the start. So, and also the treatments for ovarian cancer can be quite extensive and grueling, so like including surgery, a long post-operative recovery period, and aggressive chemotherapy at times. So given that women need to adjust to both, the physical tolls of the treatment that happens quite quickly, as well as the emotional impact of coming to terms with the illness, this can really predispose younger women to experiencing psychological distress, depression, and anxiety. And research has shown that psychological distress associated with ovarian cancer tends to be worse amongst women who are younger, who have been recently diagnosed, who have advanced disease or recurrence of disease or progression in their cancer. So I'll talk about one of the commonly asked about topics, that is the relationships with peers, particularly same-age peers. So clearly this is something that's hugely impacted by an ovarian cancer diagnosis. Often younger adults or people who are the same age as you may have little experience with dealing with an illness like cancer, and they may not know how to act around you. And a cancer diagnosis in itself may also be somewhat confronting to friends, because it's a bit of a reminder that cancer can happen to anyone, whatever stage of life you're at. And you might find that your existing friendships might change for a range of different reasons. So if you feel that, your friends who might be avoiding you or not being as connected with you as they were before, it can be helpful to sort of understand what those reasons might be. So for example, if they're not inviting you to be part of activities, they might think that you might not be able to go, or they might feel guilty about enjoying themselves if you're feeling sick, or if they're not visiting you, they might think, oh, you probably don't want visitors. So there often can be a few, misunderstandings and misconceptions about this. So this can make you feel quite isolated from your friends, and it might be necessary for you, to put people at ease and talk about the cancer diagnosis. So obviously you start with deciding what you want your friends to know. So you may consider sharing more information with close friends and less information with just acquaintances, and remembering that you are in charge of what you tell people. So you don't have to tell anyone until you're ready, of course, and you don't have to say more than you want to. But it's also important to recognize that despite all your efforts, some friendships will fade, and it might still be difficult for some people to understand your experiences with cancer. So it's important to focus on the friends who are able to support and listen to you. And talking with other women who share similar experiences can be helpful. In this case, joining a support group for younger women with cancer can be quite helpful. So I'm going to talk about relationships with family members, and I'm including partners into this, just to make it more concise. So because your partner or your family members may be primary sources of support, the cancer diagnosis can really have quite a huge impact on these relationships more than others. And also there might be pre-existing tensions within the family that can add complexity to the situation as well. So the diagnosis of cancer can not only, obviously it's overwhelming to you, but, it's quite common for family members to experience, a lot of sadness, frustrations, and that sense of helplessness and hopelessness as well. Of course, it's important to also recognize that, there's often that balance between wanting to be independent and also needing care and needing support from your family. So you might experience family members becoming quite protective and needing to talk to you more frequently, or giving you a lot of unsolicited advice. But it's all, in one sense, it's quite natural that parents and family want to protect you and talk to you and take care of you. But it can also be important to assert your independence as well, so you gain some control back. On the other side, so for some families who face challenges of cancer together, they find that this strengthens their relationship bonds. So the uncertainty about the future, can help people, sort of really reevaluate their priorities and reinforce the importance of their relationships. And it can be really challenging to discuss certain topics relating to cancer. Even couples who might, typically communicate really well may have trouble talking about cancer because it involves a lot of intense emotions, and you fear upsetting the other person, or you feel, guilty about having certain negative thoughts. And some topics are naturally hard to discuss, so things like sexual problems, fertility concerns, physical limitations, or even possibility of dying. But what a lot of research has shown is that if hiding feelings often creates more of a distance between partners and family members, and actually prevents them from supporting and comforting each other. So it can be quite important to actually broach the topic even when it feels difficult. So here are some very brief suggestions. So like I said before, it might be helpful to try and talk openly and honestly to a partner or family member that you are close to. And also, attempting to try and identify what different ways you might cope with the stress. So, for example, one person might view cancer as a problem to be solved, while the other person needs emotional support and validation. So both have valid responses, but there might be a different way at tackling or coming to a problem. And it can be helpful to sensitively listen to the other person's perspective as well, and expressing how you feel. It's also important to discuss practical concerns, so things like decisions about treatment options, changes to routines, changes to future plans. And my final point there is about, if you find it really difficult to broach these topics and to confront these things, it is important to seek individual counseling or family or couples counseling to help you with this process. So you might learn different ways to cope with the changes in the relationship and how to communicate this in a more effective way. So I'm going to move on to body image. So as you will know, as part of treatment, many women experience, bodily changes, including things like hair loss, and weight gain. And after treatment, it takes time for the body to adjust and, for you to go back to look to how you normally would. And even then, some changes might persist. So, for example, hair grows back, but it has a different texture or a different color, or it doesn't quite look right. And changes to your body after cancer treatment can, make you worry about your body image. And it is normal in that perspective to feel anxious and less confident, to feel quite angry, sad and quite helpless, or a combination of all these emotions. Some women even feel that, they're no longer the person they used to be, and they worry about relationships and feel really self-conscious. So the first thing to remember is that it's, you'll need time to adjust to these body changes, and it's important to be kind to yourselves during this period of adjustment. Very commonly, people try to avoid situations that make us feel anxious. So examples of avoidance include things like, you avoid looking or dealing with a particular body change, or you decide not to go out at all, or you avoid looking at mirrors or shopping for clothes. And although this might be a relief in the short term, because, it can, you feel less anxiety, but it can make things more difficult in the long term, because it doesn't give you that chance to find out if facing your fear is as bad as you think, and that can keep the anxiety and the fears going. So if you do have a visible change, try not to delay, addressing it and looking at it. It can help, to talk about how you feel regarding these changes with someone that you trust, or other people who might be going through quite a similar experience. It's also quite important to gather some of the practical information about dealing with these body changes, and there is information out there. So speaking to your nurse coordinator or social worker can help with that. So when you take little steps of positive action to try and deal with each change, that can be quite empowering because it gives you back some control among these bodily changes that it's completely out of your control. It can also help to remind yourself of the unique aspects of your identity. So I've said there, seeing yourself as a whole person. So often your family and friends will be able to tell, oh, these are certain aspects of your identity and personality that they come to love and appreciate. And although we often tie our appearance to our identity, it's important to remember that we have a whole range of other strengths and desirable qualities that continue to exist, even in the face of these changes in terms of the physical appearance. So moving forward after treatment, so that's the point where it can also be quite a struggle. You might have less follow-up visits with healthcare professionals at that point, and your family might expect you to go back to being normal or how you used to be. And you might also have your own expectations of how you should be or what state you should be in physically and mentally. And this adjustment can be very challenging and quite isolating as well. And living with, that uncertainty about cancer and the future is not, it's never easy. Fearing cancer recurrence can make you feel very separate from other people who might be at the same stage of life from you. And it's important that you remind yourself that fear and anxiety are, a normal part of your survivorship, and worrying about cancer coming back is usually most intense probably in the first year after treatment. And what we find is that the worry often gets better over time. So there are a few quick, some quick strategies I've listed here to manage this fear of cancer recurrence. So the first step can include recognizing, your thoughts and emotions surrounding cancer coming back, and also knowing your triggers for increased anxiety. So whether this might be, watching a television program that talks about cancer, or seeing your friends, on social media, getting through different milestones in their lives. So whatever those triggers might be. So just, being aware of what your triggers are. As well as being well informed. So finding out what symptoms you should pay attention to and what symptoms, that something that is not concerning. So being aware and getting that information from your treating team. Also discussing follow-up care with your healthcare team as well. So knowing what the plan is and knowing, when your follow-up appointments or how often they will be spaced out, and knowing what to do if you are concerned between, from one follow-up appointment to the other, and who you might be able to contact. So that can sort of ease that anxiety. And the last point I've said here, so that can often be underestimated. So finding ways to manage your everyday stress. So these can include, really simple things of having a bit of a plan of what to do when things get overwhelming. So even if that might be, sitting for a few minutes and doing a relaxation exercise, or, having a chat to a friend on the phone, or taking a walk in the park, or being in nature, whatever it might be that might work for you to help to manage that, the daily stresses that you face when you're coping with cancer after treatment. So the last point I have on this slide is about the loss of identity. So it is understandable that the roles you previously tied to your sense of identity, like work, study, relationships, may have changed quite significantly during the process of being diagnosed and treated for ovarian cancer. So some people describe it as, this sense of emptiness and like experiencing a certain sort of vacuum inside. So it can help to, work through each aspect of your identity, each aspect that your identity was tied to, and coming to terms with how that might need to be reframed or changed in a certain way. So it might involve, establishing a slightly different sense of identity or a new sense of purpose. And to help with this process, it can be good to clarify what your core values are and what your beliefs are. So these things that are important to you, regardless of the roles that you held before, and and making that commitment to act in accordance with those values that you hold dear to you. So talking through these things with others can be good, because sometimes we're often not aware even of our own strengths or our own values and beliefs. So, so that might be something you might like to explore as well. Yep.
Thank you very much, Dr. Pillay, for that wonderful presentation. So we just have a couple of questions that have come up. The first one is, how can I access a psychologist, and how do I know if he or she will be appropriate for me?
Yep, so there are a few ways they can go about taking psychological support. So the first port of call, I would say, would be approaching your treatment team. And they often have psychologists that they refer patients to. So in that sense, you'll have that recommendation from someone that you trust that can help. There might be a psychology team in the institution that you're getting the treatment from. Otherwise, your treatment team can refer you to a psychologist in private practice as well. And the second option would be going onto the Australian Psychological Society website. And there's a tool there that says find a psychologist. And you can actually search for a psychologist who is in your area, and you can check a box that says, has expertise in cancer or health problems. With regards to knowing whether the psychologist is appropriate for you, you only know that from, attending 1 or 2 sessions and trying, to be open and honest with the psychologist about how things are going for you. And of course, we all connect in different ways with different people. So if you do find that a psychologist isn't a good fit or you don't feel comfortable, there's nothing wrong in expressing that and trying to seek support from someone else who might be a better fit. So it's just important to give it a go and see what works for you.
Fantastic, thank you. And just one more question. Do you know of any support groups for women in their 30s who have been facing cancer with pre-existing mental health problems?
So that's very specific, isn't it? So if you go onto the Cancer Council Victoria website, I know they have a list of support groups, and actually I think they do it by location as well, so that will give you the option of joining a support group that might be appropriate in the area that you can access. And you've mentioned pre-existing psychological issues, so it sounds like a support group might be helpful, but it sounds like it would be helpful to have to seek support from a psychologist as well on a one-on-one basis, since it can be more complex in that case.
Fantastic. Thank you very much, Dr. Pillay. I really appreciate your time, and thanks for that wonderful presentation. So I'd like to now hand over to our third speaker, who is Dr. Francine Marques.
Oh, hello. Hi, Vanessa, and hi, everybody else. First of all, I'd like to thank Vanessa and Ovarian Cancer Australia for the invitation to talk to you today. And I also thank Brenda and Martha for the very insightful talks. They covered a lot of things that I was going to mention, so they made my job much easier. So as Vanessa mentioned, I'm an ovarian cancer survivor. So I'll briefly tell you what happened to me, how I found out, and then things that I found along the way, issues that I had, and hopefully some solutions as well for some of the problems being diagnosed with ovarian cancer at a young age. So I was born in Brazil. I have been in Australia for 11 years, and it's home here now for me. And my mom had breast and ovarian cancer. And when I was in Brazil about 4 years ago, doing a normal checkup with my sister, who is a gynecologist there, she found I had a small cyst in one of my ovaries, and it was a benign cyst. But because I was going to be here, she asked me to go to the GP and monitor every year to make sure it wasn't growing. And 2 years later, I went back to the GP, so in 2015, and did the ultrasound and came back to get the results, thinking everything was going to be fine, and also that the cyst on that side was still the same size, nothing had changed, but there was something else on the other side that was suspicious. So I was sent to a gynecologist here in Australia, who told me I had just a cyst. There was nothing for me to worry about, and I could just repeat the ultrasound in 6 months. And lucky for me, my sister didn't like the images I had sent her, like the photos, so she asked me to go back to Brazil and do keyhole surgery to remove the cyst. And during the surgery, when they opened up, they found out I had no cyst. I actually had ovarian cancer. So everything moved really quickly. because I did the keyhole surgery on a Friday. On Tuesday, the pathology results came back. On Wednesday, I was told by the doctor that I had ovarian cancer. And on Thursday, we had another surgery then to remove everything. So I was diagnosed with stage 3, so quite advanced. And because of that, we removed both ovaries, my uterus, omentum, the lining of the cavity and everything else. So I didn't have any kids beforehand. I was only 31. And because of that, I can't have kids naturally. But I'll tell you a bit more some strategies that we have been trying to use to deal with that. So what my treatment involved were the 2 surgeries, as I mentioned. And then I did 6 cycles of paclitaxel and carboplatin that lasted about 5 months altogether. And during the beginning of the chemo, my veins were really hard to get. So the doctors thought it was a good idea to put a 4-day calf, which I would highly recommend to any other patient, because then they can inject the chemo and they can extract blood directly from that. Makes your life much easier. However, in my case, they had issues during the procedure, and I ended up with a punctured lung, and because of that, my lung collapsed, and I ended up in the hospital for a week trying to fix it. So that wasn't very nice. Something as well that I did during the beginning of chemo was to use a scalp cooling system to try to keep my hair, which I also would highly recommend. Halfway through the treatment, it stopped working, and I started losing a lot of hair. And because of that, I still had to shave and wear a wig and all of that. But you can see in the photos, it does get quite cold. But I would highly recommend, if you have the option, to at least try, because it might be a way of trying to keep your own hair. And I also found during chemo that there were several issues that I couldn't find good, reliable information about. You also leave your first chemo session with a list of problems, and side effects that you're going to have, but nobody tells you how to actually deal with them. And because of that, and being a medical researcher, I decided to put together a blog called Chemo and Beauty. So in this blog, I'll share tips on well-being and beauty for other cancer patients. And I'm also always happy to help, to share my story, to talk to people, to listen to you as well. So if you ever need anything, please feel free to contact me. You can contact me through the blog, through Facebook, even my email, my mobile. I'm very happy to help other cancer patients. And so I finished my chemo 2 years, and tomorrow will be 2 years and 1 month ago. I am trying to move on with life, so I haven't updated the blog as much as I wish I would. And the reason for that as well, because life got busy. We bought a puppy early in the years. You can see in the photo, she's very, very cute. She gets away with a lot of stuff that she shouldn't. We also got married in June this year, so the photo is from our wedding in Portugal. And we bought a house recently too, which is a new house for us, old house though, and requires a lot of work. And I still have regular checkups. Up to last month, I had a checkup every 3 or 4 months, which every time you're going to the checkup, it's very stressful. There's a lot of anxiety around what if this time it's going to be bad, what I would do. There's of course, the stress related to having a wedding booked, just buying a house and all of that. But I decided that I was not going to stop living my life because of cancer and risk of recurrence. And also, of course, long-term side effects of the treatment, including being on menopause. I am taking HRT now. Also some side effects such as the so-called chemo brain, which I'm not sure how much it is still because of the chemo or because of menopause or who knows what. But that I still have to deal with on a daily basis. And what I want to talk to you then is some factors that I wish like other people had told me in the beginning, and I wish cancer patients were told as well as a group. We talk a lot about like chance of 5-year survival and all of that, and I think we forget a bit that we are all unique people. We all have a different story. We all have a different health status at the time of diagnosis, and we shouldn't be treated as populations. Like we should really be having our risk individualized. So don't go to Google. The statistics in general are not very good. So try to discuss with your doctor who know the best, like for your case, what like your chances of recurrence and chances of cure and so on are. Also, side effects of treatment can be debilitating. I was like young, healthy. I thought at the time of the diagnosis I had a lot of energy, and I didn't think that fatigue. And when the nurse told me there might be days you might not be able to get out of bed, I didn't think that was going to happen to me, but it did. So they can be, like the side effects can be debilitating, and they're real. So just allow yourself to take the time to actually go through it and recover well. And some of the side effects might last a long time after the treatment is over. I can tell you that I felt I had my energy levels back about a year later after I had finished chemo. And even there's still days that I might still feel exhausted from like it comes from nowhere, and they just get more spaced out now. But yeah, some of the side effects can last for a very long year, including also, of course, menopause is permanent. And also know that not all sources of information are reliable, so know where to look for information. Contact Ovarian Cancer Australia, Cancer Council as well. Like if you understand a bit about medical research, you can read like scientific papers, which is the best source of information directly from the source. But just be careful with a lot of bogus websites and a lot of Mel Gibsons and so on that will tell you that you can drink lemon or buy cab or like do this or that you get cured, because that's not all true. There is no evidence for that. And I think that also puts a lot of stress on us, because in the end of the day, you start feeling guilty about not doing all those things as well, which there's no evidence against for us to be doing. And in terms of then some solutions for the problems that we do face as young patients of ovarian cancer, is one of the main issues. I think it's that feeling normal again. And I know that for me, like having my hair back, having like my energy levels, going back to my normal lifestyle, these were like priorities for me. However, of course, not always is achievable in a short term. And what I like to say is that we need to learn how to have our new normal, because sometimes the old, like our old selves, we can't just go back. However, try to enjoy now. Think about like your new life, like take baby steps. Every day is a wonderful day. Be grateful. Find new hobbies, things you always wanted to do and maybe before you didn't prioritize, you didn't have time. So these are all things that you can try to recreate normal. And in terms of body image and self-esteem, like there are issues related to weight gain. It's actually quite normal. And I remember before chemo, I always thought that patients with cancer would lose weight, but it's more common that patients will put on weight. Now, of course, having a healthy diet, exercising, these will always help you to manage your body weight and also to improve your lifestyle and decrease chance of recurrence and any type of cancer and also heart disease. In terms of the hair, you need a lot of patience. I can tell you now that I'm 2 years after chemo that my hair is touching my shoulders. It took a long time for the hair to grow and for me to be happy about it. I think the first 6 to 12 12 months were the hardest because the hair was short, and it came back a different color, different texture. So you have to learn how to deal with a different length and then the texture and the color. And it is hard at times, but just keep thinking that like it's a long process, but you get there and you'll be happy with the hair again. Like the color came back to normal after now 2 years. The texture as well came back to normal. So don't give up on your hair and on yourself. And also for a lot of the things that I'm discussing, there'll be lots of blogs that I have written about how to deal with these things. So go and check, and please, contact me if you want any information more, if you want to discuss anything. Then in terms of menopause, it was quite difficult to deal with, especially because like being young, I was in a relationship at the time and all of that. And I remember that nobody mentioned to me about HRT being an option. It was good that Martha did mention. But what happened was that I spoke to someone that had ovarian cancer that I met, and she was young as well, and she told me she was a GP and she was on HRT. So that really showed me that it was something that I could do as well. So I went on and asked my onco-gynecologist, and she agreed that it was a good idea. So I have been on HRT for the past 2 years, and I really don't regret it. In terms of infertility, I also ask about options for fertility preservation. Again, when we're diagnosed, sometimes it's the last thing that we're thinking about, and it all happens so fast that you lose a little bit the control that you have over your life. What happened in my case was that when I was diagnosed, I was still in Brazil, and I went through the second surgery there. And my sister had spoken to one of her supervisors who was owner of a fertility clinic, and they offered to come over during my surgery and collect my ovarian tissue. There is still not enough I think there's not enough methods available to actually generate eggs from ovarian tissue in vitro, but we hope that in the future, in the near future, there will be. And we'll need a surrogate mother as well, which is, I know, tough, but we'll hope we'll find one when the time is right. So remember to ask whether there is an option for you to preserve ovarian tissue, eggs, or something like that. And in terms of something that absolutely nobody talks to you during the whole treatment, and you can, again, ask, is about sex life. So my sister being a gynecologist, we're close enough for me to open up with her and ask about it. But I know that no oncologist or even the gynecologist that I'm saying here, GP or anyone else, ever asked. So remember, you have the option to do that. You can have sex during your treatment. You can have sex after your treatment if you feel like it. If you don't feel like it, you shouldn't be forced to. But yeah, again, being on the HRT or even just using local hormone might be able to help with that too. And again, as Brenda mentioned, feeling isolated, because it is quite common because we are young. Most of our friends at this stage, they are doing what people in their 20s, 30s, and 40s usually do. They're getting married, they're moving on with their lives, having kids, and sometimes we have to face, for example, in my case, that I can't have kids, or at least not that easily. So there is always issues that we have to face, but there is always support groups and other people that you should be able to talk to. There's a large community of cancer survivors in general, not specifically to ovarian cancer, and a lot of us who have similar issues, so you could always go and talk to other people in the same age. And of course, also issues related to finance, because you might need to stop working. in my case, and I know that that's not for everybody, I decided that I wanted to try to keep working part-time because I didn't want to be just home thinking about my treatment, thinking about cancer, feeling sorry for myself. But I know that sometimes you're too unwell to do that. So if you don't have a flexible job, that might be more difficult. And dealing with the anxiety and fear that also are associated with the whole diagnosis, the whole treatment, and like every single step of the treatment and after as well, when you're just monitoring if the cancer is back and is still free of cancer. I know that that's also very difficult. The best way that I find is distracting myself and really just avoiding thinking about it, but just moving on with life. And I decided that I didn't want cancer to control my life. It had already taken so much, and I think that really helped so far. And finally, remember to ask for help. Help at home with like getting your daily activities done. Help like with cleaning, with cooking. Like when people offer you help, say yes and tell them exactly what you want, because some people want your help but they don't know what to do. So tell them how they can help you. But I also ask for help like from the Ovarian Cancer Australia, from the Cancer Council, from like other sources of like that you can get information that can help you as well, make you informed decisions, and just like still enjoy life. I think that was all for me, but as I said, again, please feel free to contact me if there's anything else I can help you with.
Thank you so much, Dr. Marques, for that incredible insight into your journey and your cancer experience. Absolutely incredible. We do have a couple of questions for you, if you don't mind answering.
Yes,
one of
definitely.
them is, what were your main questions when you were first diagnosed? What were your questions that you wanted to know?
I remember as soon as the doctor told me about like the diagnosis, I asked him, and it was all a series of horrendous answers. I asked him, I said, so do I need to have another surgery? And he says, yes. Do I need to have both ovaries removed? Yes. Am I going to be on menopause? Yes. Do I need to do chemo? Yes. Am I going to lose my hair? Yes. It was everything like very negative. I think like there were questions that I didn't know about, like the preservation of my ovaries that I would like to have asked at the time, but I was lucky that someone else came along and helped me with that. Also being able to use the hormone replacement therapy, I think that was very important to improve my life quality after cancer treatment. And just like knowing that you still can have mostly a normal life even during chemo. And that was not something that I expected, but I was still happy. Like as you can see in the photos, still like going to the beach, spending a lot of time with my friends and family, and that actually brought us a lot closer, which was really good.
That's fantastic. And did you feel there were areas that you did need more support in? I know you've mentioned some of them already in your presentation, but any in particular?
I think like going and seeing someone, like I saw a therapist that I hadn't seen before, was helpful, because there are things sometimes that you don't want to tell anyone else, like how you might be afraid, of dying, and what, if you go down that path, like what is going to happen. Things like that sometimes you don't want to tell your family or friends. Also just being able to talk about how you feel, and sometimes the only other people that might understand it is someone that has gone through something similar. So connecting with someone else that is going through something, similar as you is helpful too.
That's great. Thank you so much. Does anyone else have any other questions? If you do, just type them into the chat box in the bottom left-hand corner. No, doesn't seem like we do. Okay, well, if there are no more questions, we'll leave it there. Once again, I'd like to say a big thank you to our speakers, Professor Martha Hickey, Dr. Brenda Pillay, and Dr. Francine Marques. We really appreciate the information that you've shared and the time that you've given us today. Thank you everyone for being on this webinar. We really hope you found it valuable. The recording of the webinar will be posted on our website, and you will receive an email with a link to the recording in the next few days. In a moment, just when I finish up, you will be directed to an evaluation form. If you could please take a moment to fill that in, as your feedback is extremely important to us and will help us to plan and develop future webinars. And if you do have any other questions that you would like addressed, please don't hesitate to contact our information and support line on 1300 660 334. Lastly, the support team at OCA will be continuing to provide support specifically to younger women in the coming months. So please look out for an email from us asking for your suggestions around what would be most useful to you. So thank you again, everyone, for being on the webinar, and we hope to see you for the first webinar of 2018. Have a great day. Goodbye.